Shalma, nice to see you here. Shalma from Facebook asks, will sound therapy for tinnitus reduce the volume of the sound?
Both probably should comment on this question. That is a good question. Oftentimes, it's a long process. So keep that in mind. These kinds of changes don't happen overnight. It can take upwards to a year for some patients. Some patients it takes less. Often the first things that we start to see with our patients is that the tinnitus just overall becomes less bothersome. It's less of annoyance. It's less affecting daily activity, life, etc. That tends to sort of start to resolve first. And then I start to see that the volume comes later. That's my experience. I'd be interested to hear what Dr. Thompson's report would be, but typically I see the volume as the last step when we're treating our tinnitus patients. I'll give you an example. Today, I've been seeing patients all day, and their volume might be the same as when I saw them, say, a month ago, but they're less bothered, they're less annoyed, they're not noticing their tinnitus as much throughout the day. In fact, that can drastically change, but the volume might still be there if they actively have to focus and sit and listen. So, but often the volume will improve over time. So that's been my experience. I'd be interested to hear what Dr. Thompson has to say.
Yeah, the good thing is that tinnitus volume can reduce, and it's a medical condition that's different than most where it takes a lot of time.
Mm-hmm.
I agree with you, Dr. Ramsay, that first the awareness or the annoyance of tinnitus is defocused from the brain. It's improved.
Mm-hmm.
And when that happens, that's setting it up so that the volume can reduce, but not always. So sound therapy helps habituation. Habituation happens in the brain,
Mm-hmm.
and oftentimes the sound gets softer through habituation. So you could use the transitive property there and say, sound therapy helps habituation, and habituation can reduce the volume. So if you wanted to do everything you can to help tinnitus, we would say follow a sound therapy protocol, work with a good audiologist who can help you through that. Don't try to do it yourself by using headphones or here and there. Really
Mm-hmm.
commit to something and use it long term along with some other tools. And that's what we see as working. As I was describing earlier, this tinnitus guide that we created, the 2022 tinnitus guide, it covers sound therapy and other techniques and methods. So what we do is we use all of them. We use anything we can that's shown to clinically improve tinnitus, sound therapy being one of them. Thank you, Shalma, for the question.